Hi, I'm Dr. Mike Milligan. We're here at the American Academy for Oral Systemic Health inaugural meeting. I'm here with one of the keynote speakers, Dr. Duane Keller, owner of PerioProtect. Duane, thank you so much for being with us. Why don't you give us a little insight into PerioProtect, the development of that, and what you're seeing it can do systemically for you.
Okay.
Can we go over that?
Sure.
Okay.
The easiest way probably is to understand that we can finally deliver a medication into the infected area,
Right.
and begin to treat the cause of disease,
Right.
which is firstly the local cause of gum disease, and then we can convert that from an area that's conducive to disease to one that's only conducive to health and healing. And when the body doesn't have to fight the infection here, then systemically the immune system can do whatever it needs to do elsewhere,
Right.
because you're not having to fight as much of a disease process in the mouth.
It's just incredible, and what a phenomenal talk he just gave to the whole group. So let's expand on that just a bit, what you just said. And this is non-invasive. It's just a tray that the dentist can take impressions and make. And I don't mean just a tray. It's scientifically designed. But then they utilize this tray with medications that you put into that.
The tray is designed so that it has a seal that goes around the teeth, and then the doctor can put any medication in that tray that he wants to. We presented some of the research that we've done. Actually, it's not research we've done. Some of the universities and other independent studies have now done, which are in the publication process, that shows you can eradicate about 99.93 to 99.98% of the bacteria. And when you do that, then you're not having to deal with the cause of the disease anymore.
Right, and a couple of the main medications, and by the way, the tray is designed so that it will even move up into a 12-millimeter pocket, and so there's some specific design to this, the exact depth and resistance of the tray and all.
Whenever a doctor wants to make one for a patient, what they need to do is they need to, well, first be certified. That's one of the steps that the Food and Drug Administration has asked that we do. So we have certification programs. But then they can send in a copy of the models of the patient along with the probing, and then those trays are custom formed in accordance to the conditions that are there.
Exactly.
And then as healing occurs, you change the frequency and duration of the medications, and or a number of the patients will need at least another set of trays as healing occurs.
Okay, all right. And also then the medications that you're using are primarily hydrogen peroxide and doxycycline.
Our research basically has shown that hydrogen peroxide is probably the best medication to penetrate the biofilm and to kill the bacteria.
Right.
And we use doxycycline for its antioxidant capacity, not because it's an antibiotic. We want it for the antioxidant and anti-inflammatory aspects.
So the hydrogen peroxide liberates the oxygen, and the anaerobes, which are some of the worst bacteria, it will kill them first.
Yes, sir.
And so that's why the hydrogen peroxide is such a good medicament put in there. But also the doxycycline then will control the osteoclasts and eliminate many of those so that you're not getting bone loss, and it will help the formation of the osteoblasts so that you're growing bone. You showed some incredible x-rays and documentation of growing bone where in the past these teeth would have been taken out, or the implants taken out, and after 20 years you were having great results of bone growth, and bone that was even stronger than the original bone because it was infused with doxycycline.
Yes, sir.
Can you expand on that just a touch?
Well,
or did I steal your thunder?
You did. I think you explained it well. I'd say yes, and we'll go from there.
Okay.
Doxycycline inhibits the cells that break bone down, and it fosters or actually excites the cells that make new bone. So if you can stop bone loss and augment bone regeneration, we now can also control the bone mechanism around the teeth, or the bone that supports the teeth.
Okay, and so now let's touch on the last part of this, that if we're doing this, not only are we saving the teeth and the health of the gums, we're talking not only getting the pockets down to 3 millimeters or less, but down to 1 millimeter. I mean, it was incredible, the results here. But also now, so we've got a healthy mouth. Now what does that do and relate to the health of the rest of our body?
We now know that there are a lot of the bacteria that can become systemically involved. And all you almost have to do is pick up any magazine and you see a relationship between the bacteria and cardiovascular disease, stroke, type 2 diabetes, preterm low birth weight. And it's pretty well documented that they get into the circulatory system, and then if they cross the placenta, they can have effect on the developing fetus. There's research that shows they're involved with arthritic conditions now. A ton of research about cardiovascular aspects. I mean, we had some wonderful speakers talk about that. Right. But if you don't get the bacteria in, you don't have the cause for those diseases as well.
If you control it in the mouth, then you don't have that going through and causing the other diseases.
Correct.
Plus, your immune system now isn't fighting this, and you've got that immune system. Say if you've got you said a 10-level immune system that you have to take care of your whole body, and 4 of it's working here. You only have 6 left. Well, if you got none working here, you've got all 10 to work through the rest of your body and prevent disease there.
Correct.
Is there anything else that you'd like to tell us in this short interview?
I think that the main thing that dentists and patients need to realize, it's easy, it's simple, it's affordable. The system costs about 30-40 cents a day, so you're not talking something that's out of most patients' reach.
Right.
And the best thing, it works.
It works, right. Well, how do we get in touch with you for more information about PerioProtect and the research that you've done here?
The best way would probably be go to the PerioProtect website, which is www.protect.com.
Great. And then you give presentations and courses from time to time, and on that site we can find where those are.
Yes. I have a wife that allows me to travel 40 plus weekends a year.
40 plus weekends a year. So it's out there, and great course to go to for the benefit of your patients, and not only their oral health but their entire health.
Well, thank you.
Dr. Keller, thanks so much for being with us.
My pleasure.